I don't know if I'm hot or cold, so just please don't let this distract you too much from today's presentation. I am going to be, haven't signed any papers yet, but the new director of the Rainbow Center for Women and Children that they just built a few months ago over on 55th and Euclid/Chester. I've been involved with adjunct faculty role ever since I graduated, so this is now year 6 of me teaching. I've usually taught as an adjunct. You guys get free parking, okay? So I've given this lecture for the past 6 years for $10. All right, now, hopefully in about a few weeks or a month or so, I'll actually get paid real dollar bills, and then I'll take a little bit, we might start to have parties because I can actually afford it. Okay, so this presentation, I'm a board certified pediatric dentist. I don't take life too seriously. I was in y'all's chairs just a few years ago. And this is just, it's a great presentation. Everyone tells me how awesome it is, how it's one of the best presentations, lectures that they've had since they've been here. That's why I like to go early so I can set the bar really high and y'all don't have too much to compare it to. I like to laugh a lot, and so we're gonna start off with a good laugh. You guys have probably seen this video.
Hi, my name is Sarah, and today I'm going to teach you how to make vanilla ballad.
Vanilla ballad, I don't know what
Here are
that
the ingredients you'll need. Well, you can actually use any kind of fruit you would like. But here's the fruit I'm using. You can use some apples, blueberries, and strawberries.
Annoying little sister.
Sure. Pour all the yogurt into a bowl. Wow. What up? What? Maybe a handful. How can you get outside too? They're kind of hard to get just a handful. That is disgusting. That is yumma. There's apples in there? Apples, blueberries, and strawberries. Little bit. You forgot blueberries. I said blueberries. Blueberries. Blueberries.
The way she looks at the camera kills me. So all of you that laughed, I at least know I won't be in hell alone. Thank you. Just I don't really want to. Hilarious. So, all right. So now that we got the laughs, I don't know what y'all were just talking about, but bones and I don't know what he was talking about. At least it ended with a nice picture of Croatia. So when y'all, worldly travelers. So, do I have a slide about me? Yay. Because every doctor loves talking about themselves. I did my undergraduate, I'm from the Cleveland area. I grew up in the city of Euclid. I currently live in Cleveland Heights. And I went to University of Pittsburgh, so that was kind of a big deal to leave the dog pound to go to Steeler Nation. It made me confused because I just rooted for football, so I would wear my Browns jersey with a black and yellow jacket. So real fashion forward, but I wasn't trying to get beat down in Pittsburgh. Came back home to literally, to learn and really just, lay my roots back here as far as my profession went. And attended Case Western Reserve University, graduated in 2010. So you guys have already had y'all are already in September. So y'all have y'all had vendor fair yet? No. Okay, so is that coming? I guess it's, when is it?
Next week.
Okay, cool. Go get involved, learn all of these folks, get the contact information, get an idea of who does what, and then just kind of tuck all of that stuff in the back of your pocket. A lot of those companies, I don't know if they're allowed to do lunch and learns anymore. All the rules keep changing, but get involved. From there, ASDA, you guys have an ASDA rep already, or 1 or 2? How many y'all do these days? 2? Who's y'all's ASDA reps? But don't be shy. Who? 1, 2, both of y'all? Oh, okay, great. So that was me. I was an ASDA rep for our class, and then I think I became president my second year. then after that, I sought national leadership positions. I was a council chair on education. And then I had gotten appointed to, they called it Committee D, which was about diversity. And that was a 2-year commitment. And then I was on the Joint Commission on National Dental Exams right around the time they were transitioning from a score to pass-fail. So I had that role and was a voting member of the Joint Commission my senior year. Can you guys hear me? I figure I'm kind of loud. They no longer have the SMDEP program. It's now something else, but it stood for Summer Medical and Dental Education Program. It was a pipeline program for rising sophomores and juniors and undergrad who were interested in medicine and dentistry. And I taught for that. Because you guys get the summer off between first and second year. That was when I started doing I started off as a TARA for the program and then did it for 10 years. That was how I spent my summers, not as a TARA. I needed to eventually make real money. So, and then, but I taught dental anatomy, and then we had some hands-on clinical experiences for the students. I'm still involved in the Alumni Association. I'm no longer vice president though. Did my residency here, I said that. Okay, who all is paying, like who can write a check? You don't really have to raise your hand. Who's paying for their dental education? Or borrowing money to pay for your dental education? All right, raise them high. Okay, all right, who likes free money? Right, okay, so I was a National Health Service Corps scholar. Think about it, if you're interested in serving underserved populations, this might be an avenue to do it. Gravity and cheeseburgers kept me from doing the health profession scholarship thing that the military does. So I couldn't do the flexed arm hang, all of this. Gravity, okay? They unflex real fast. So I was like, okay, let me still go with the government thing and without the physical fitness. Okay, then I just let myself go in dental school. Just kidding. Anyway. Dental mission trips, you guys have, I know the SNDA goes to Jamaica every year. I don't know about other programs. We weren't really doing too many international mission trips when I was in school, so I kind of just live vicariously through students who have participated. I did a mission of mercy. It was a mom mission down in West Virginia when I was in school my senior year. But I have gone to internationally. I have gone to Kenya annually from 2014 to last year, and that is with Global Dental Relief. Just in case y'all were taking notes and all of that stuff, Global Dental Relief is a nonprofit organization that does primarily pediatric dental missions. They go to Guatemala, Nepal, India, Cambodia, and Kenya. I think that's it, but if you guys Google Global Dental Relief, you go to their website, then you see all of the fun stuff that they've done. In 2015, I was named I received the Outstanding Dentist Award. The following year, I was the Rising Star Award recipient from the African American Alumni Association here at the university. I rejoined the board of directors and am currently serving as a secretary-treasurer of Greater Cleveland Dental Society. I already told you guys about this. And I became a business owner this year, and I will be opening up Panther Pediatric Dentistry in October in my hometown of Euclid. And let's go to the website right quick. I think you can click. Can I click on this? Don't do anything? Okay, hold on. Oh, Lord have mercy on this fancy pants. Oh. Yay, there's my website. So the people have, they just took the final payment out. They just charged my credit card another $12,000. Lord Jesus, about that free money. But this is still a work in progress. I don't have a phone number, don't have a fax. And every time they send me some stuff about the homepage, I'm always changing 1,000 things. So I'm pretty sure I'm their worst client, but make sure I'm spending that $25,000 the way I want to. All right. So I think that was it for all of my. Okay, Lord have mercy. Where we just at? Okay, that is it. All right. Anybody have any questions so far? I probably should have put my email address up there. I don't think I did, so maybe I should do that. If you guys want to be my friends.
I think you have it on the first page.
I have it on the first page? Okay, great. Do I need to go to that? Oh, y'all have it all, right? Yes. So feel free to reach out. In your subject, let me know that y'all are a dental student. Okay? And then I'll try my doggone hardest to get back to you. But don't feel like you're bugging me if you have to circle back, because I have never fielded so many emails and had so many conference calls and stuff like that in my whole life than what I'm doing with starting this practice. All right, today and tomorrow we're going to define pediatric dentistry and a dental home. We'll discuss what the Surgeon General said in 2000 in his report on oral health in America. We will talk about caries. Are you guys taking cariology right now? Okay, so we probably won't have to spend too much time on that because you guys are all pros now. Identifies ways to prevent dental caries and dental infection. We'll talk about behavior guidance and advanced behavior guidance techniques recognized by the American Academy of Pediatric Dentistry. We will talk about sealants and how you guys should approach the sealant program from the aspect as a pediatric dentist in training, so to speak, but coming at it from a friendly standpoint for the youngsters. Identify teeth in the primary and mixed dentitions. Demonstrate, I'll talk to you guys about a head and neck exam. This is more like an FYI sort of thing, and I would probably put it in the back of your mind, but not too far back. It's very systematic. It's the way that I do my head and neck exams, and I tend to not miss anything. It just gets you get into a really good routine and be consistent with it. So no matter who you're working with, it's just for me, it's a pediatric patient because that's what I do, but it's certainly applicable to adult patients. All right, intro to pediatric dentistry. Very few times will I read directly from the slide. I do for definitions, okay? So I will read verbatim what you all see. Pediatric dentistry is the age-defined specialty that provides both primary and comprehensive pediatric, preventive, okay, let's start over. Age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special health care needs. Is something blinking? It's distracting. Is there that? Okay. Because I'm about to lose my mind. But if I do that, y'all might go to sleep. What is, see,
I think those lights are just kind of
oh,
dying.
they're just, okay. I'm going to try to ignore it then. All right. It is not always, it wasn't always like that, okay? We're going to go way back to 1900. There were a few children that were being treated, yes, I'm sorry.
This may be more of an insurance type question, but so is that at 18? You have to go to a GP, or it doesn't really matter, or?
So now it's going to end up being state specific.
Okay.
It used to be, and I will hold to that when you reach the age of majority, out the door you go. And honestly, what I plan to do with my practice is once you're 16, I won't see new patients 16 and older. My thought is you've got all them permanent teeth, you potentially have big people teeth problems, and you need to see the big people teeth dentist, okay? That's for me. However, special healthcare needs individuals, will I see them into adulthood? Yes, there's not too many general dentists who would feel comfortable treating patients with spina bifida, who are confined to a wheelchair, that sort of stuff. If they're a patient of my practice, then we'll keep going into adulthood. What I might do for my teenagers who might be looking like they're aging out, if they're cavity free, I might give them the chance to stick around with me, but once they get a cavity before they turn 18, then they gotta go bye-bye. The idea of it is my concern is that if I treat these kids up until they go to college, then once they're back from college or home then now they have to establish a relationship with somebody else. And like that. Because I like Dr. Carey, not to say all my patients are gonna cling to me, but I really hope that they do. But I want them to be sent to a general practitioner earlier so they can have that relationship before they graduate from high school. So that when they're coming back home for Christmas break, spring break, those sorts of things, summer break, that they have a dental home established as an adult.
There's not necessarily an industry, like, board established aid that's like.
Not anymore. So I think it's more the ADA and all of that stuff. It was a point of contention where I believe they removed, because when we started doing things age defined and stopping at certain ages, well, we were all general dentists before we specialized in pediatric dentistry. And I think that was a point of contention for a number of the specialists. You know, if I'm ortho and my kids need to get their teeth cleaned, why can't I also do those sorts of things in my practice? So I believe from the ADA standpoint, that you can still be a GP while you're doing your specialty, but then from a state recognition standpoint, that's where I said it's state specific. Ohio might say, you know, it's 18 here, and I think it's kind of this gray area right now because they're still taking into account from a lobbying and advocacy standpoint what the American Dental Association and the subsequent specialties are talking about. But it would definitely be something to discuss. When I declared my specialty, I was legally done at age 18. But now I don't know what's going on. If someone were to be a new pedo doc declaring their specialty in Ohio, what are their circumstances? Okay? But I know the way that I signed up, I'm just gonna keep rolling with it because it makes sense to me. All right? I can do a class 2 on a baby tooth in like 10 minutes. Big kid teeth. It's gonna stay there for a bit, and and not like I half-ass it in the primary teeth, but permanent teeth, I mean, it's gonna be a little bit more labor intensive. It takes a little bit more time when we start doing multiple surface restorations and permanent teeth. Whereas a GP is doing that all day long, not necessarily my quick, efficient sort of thing. Oh, see? Still I rise. Okay, 1932, the report stated that in 4 years before, there were only 15 dental schools that had no clinical experience with kids, and 22 of them were not doing any didactic training at all. So that explains why kids aren't being seen, because no one's being taught how to see them. In 41, yay for Cleveland, we actually started Children's Dental Health Day, and then Akron kicked off Dental Health Week. And 1942, we've got that topical application of fluoride has its preventive effects, and that was described in literature about the efficacy and the effectiveness of that adjunct service. You guys know what happened in 1945, right? If they haven't drilled that into y'all's head yet. Where did water fluoridation happen? I know it's right there, but Grand Rapids. That's huge. 81. February was declared National Children's Dental Health Month, and we talked, sealants started popping into the picture. How else can we provide preventive services for youngsters in addition to fluoride application? Well, let's go ahead and block the grooves to keep bacteria from getting down into the depths of them, henceforth causing decay with placing a sealant. And the American Academy of Pediatrics joined forces with us, and we came up with a policy statement describing the oral health risk assessment and timing and the establishment of a dental home for youngsters. Does anyone know when a dental home is supposed to be established? Has anyone talked about it yet? Great, I get to be the first one. By age 1 or 6 months after the first tooth erupts. So by definition, the dental home is the ongoing relationship between the dentist and the patient, inclusive of all aspects of oral health care delivered in a comprehensive, continuously accessible, coordinated, and family-centered way. And the desired time frame is that a dental home is established no later than 1 year of age, and it'll include dental specialists when appropriate. But the other thing, because some youngsters don't get their teeth when they're 6 months, so they might get them at 8. A lot of folks don't see the value in bringing their child to the dentist when they have just 2 teeth. So give them another 6 months after their teeth have erupted, if they're missing that. But what's so frustrating is I believe dentists are much like our organized dental organizations have more market share with us than the medical organizations have of their physicians. So while the AAP has teamed with the AAPD to establish this policy on oral health, infant oral health care and this establishment of a dental home, if folks aren't a part of the AAP, then they miss that memo. So we still get kids who are coming to us at age 3 because their pediatrician said so. And what do you guys think kids' diet consists of these days? Sugar. These kids, oftentimes, so this population that is surrounding Case Western Reserve University, this greater Cleveland area, that's why the SEAL-UP program exists, and you guys will see, I'm sure y'all have talked about it already, but you'll see at 9 o'clock when you roll up to these schools and set up your dental equipment, you guys are probably, like I was, brushing out residual sour cream and onion potato chip residue from teeth, air holes in teeth, or you might be pulling out hot fries and flaming hot Cheetos and stuff like that from these kids' teeth because a quarter bag of chips isn't a quarter bag of chips anymore. A quarter bag of chips is like 50 cents now. So they can get that 50 cents, go to the corner store on their way to school and get breakfast, which manifests itself ultimately as caries with the caries process. So by age 3, these kids are coming to us in great need. Their dental needs exceed what we, oftentimes what a general dentist might be comfortable treating in the office. So then that sends even more and more to the specialist, and it's just this circle, this sad circle of these youngsters. So there is some participation in this part of the class. So let's break down that definition of a dental home. We said it's that ongoing relationship inclusive of all aspects of oral health care in a comprehensive and coordinated and continuously accessible, family-oriented, family-centered way. So we know these are general dentistry is not a specialty, but it's an aspect of dentistry, and hospital dentistry is not a specialty. So 1, 2, 3, 4, 5, 6, 7, 8. Are there 9 specialties? Which am I missing?
Should be 9.
So which one's missing? 1, 2, all these
Yeah,
years I've done
yeah,
this.
actually,
Oh, well, that's because this is my lecture. So anyway, it's given. Okay, great. Anyway, so I promise I know what I'm talking about. Okay. So what aspects from like general dentistry? What things can a general dentist do for kids? So this is where y'all know about spider diagrams, right? That all started in my class. We were that inaugural class of the real curriculum. So I was spider diagrammed to death, as are you guys going to be. So let's start here. Shout it out. Or raise your hand, so this is nice and anybody. Yes.
Crowns and root canal therapy?
Crowns and root canal therapy. Anybody else? Sealants. What'd you say? Prophies. Yep.
Pulpotomies.
I can't, y'all come on loud.
Pulpotomies.
Thank you, pulpotomies. So, okay, so I'll give this. So please be loud because I have screaming children in this ear, and then I'm right-handed, so I have a high-speed handpiece in this ear. So I can't hear a damn thing, all right? So, and y'all are too far away. I can't see either, so I can't read lips, and it's dark. So just talk loud and great. And be ready for me to shoot some questions back. So it's one of those things I learned when I started giving lectures. You never put something on the screen that you don't know the answer to. So if you guys are offering stuff, this is a great opportunity. I might shoot some things back, some things to think about and consider. So just be ready. Don't be afraid. We're not putting anybody, on the spot. It's meant to be a learning experience for everybody. Anything else about general dentistry? Extractions, yes. Okay. We given cavities? Probably. No, I'm just Restorations, yeah, filling cavities.
Basic education.
I like it, basic education, so we're talking like what?
Well, where I come from, it's
Which
surprising.
is?
I'm Alabama.
Okay.
So it's a lower income area, and it was surprising how many dentists I shadow with would, this is a toothbrush, this is how we use a toothbrush to get into the sulcus, and this is, I mean, you know, this is the importance of, I mean, it's not uncommon, so.
Right, right.
Removable prost,
How so?
dentures, hybrids,
Dentures who?
dentures and hybrids.
Okay, so
So
what
that's
kind of
just-
kid would need a denture?
Oh, then never mind.
I mean, this is a good, so
You
know,
said general.
it's a,
How to do general?
think outside the box. What kind of kid would need dentures?
Congenitally
Anybody.
missing it.
Congenitally missing teeth. See, you were right. I'm not knocking you.
For sure.
All right, what's up?
Is there like a subset specialty for general dentistry where you're trained to treat kids with developmental disorders or spectrum disorders?
So you can be a pediatric dentist because we are, but it's not something in particular. It's not some additional certificate, but there's organizations that offer CE, so you can join those and then get more intense education about it. But it doesn't necessarily make you a general dentist / special healthcare needs / developmental delay doc. Okay. All right, we've exhausted general dentistry, so let's take it one step further. Well, not step further, but another aspect of dentistry. Perio.
Prophylaxis.
Yes. Dental prophies. Gum cleanings. Is that a prophy? Could be. What were you thinking about?
Just in terms of the perio, kind of more leaning towards like the gums and kind of making like the goal of being healthy.
Okay. All right. So maybe like scaling a root plan, like a deeper cleaning.
Yes.
Who would be an individual who might need deeper cleanings?
That kid who just got out of
Those
braces.
that have like loose, I guess, loose attachment between the tooth and the gums, maybe smooth.
Pediatric dentistry. I mean, kids do smoke, really.
Oh, like
Pedo. This is our. Remember the one specialty I forgot. It's because that's the nature of this presentation. So, but I like where you're going. We'll take it. We'll see. We're going to expand upon that.
Kids who just got out of braces.
I like the
and
kid-
then gingivectomies on the same.
Right. What's your name?
Jake.
Jake.
Jake, yes.
Jake. And then your name, Alabama.
Right.
Right. Okay. Sorry, I'm gonna try. And I know all about you. So when we talked about before nutrition and food deserts, y'all have a wonderful resource in nutrition in y'all's classroom. Did y'all know that? Has that been folks keeping it secret? Did I just put you on blast? My bad. Okay, my bad. Okay. Yeah, money. Talk to mommy about nutrition. Okay. So kids who've just got out of braces and gingivectomies. So gingival recontouring. So sometimes there's gingival overgrowth because maybe oral hygiene might not have been the bomb.com while they were in their orthodontic appliances. So those children who might have uneven gingiva may be candidates for a gingivectomy or gingivoplasty once they're done. Any other circumstances? I swear when that light goes out, it makes me think the whole presentation went away. I'm really trying to ignore it. Do kids get gum disease other than gingivitis? Does localized juvenile periodontitis exist? Anybody Googling that? Anybody? Does it exist?
Yeah.
Okay, great. Yeah, so those might be folks who need it. If a patient who talked about developmental delays, one of you two. Okay. Well, if you've got a patient who has mental retardation or developmental delays, or might be confined to a wheelchair, hemiparalyzed, something along those lines, and can't reach their gums or can't use a toothbrush properly, would those be the kinds of folks who might benefit from some deeper, more focused periodontal procedures? Okay. What? Yes.
Kids knock their teeth out semi-regularly. What is the earliest age this appropriate to replace a permanent tooth with an implant?
anybody know the answer? Or can give some guidance, we can talk about it, yes.
You have to be done growing before you can get the graft and everything.
Yes, so,
So you wouldn't see this like a 13-year-old would be too young.
yes, so in that we would be using a removable appliance, something like a flipper or something with some clasp on it, yes.
Would an exposure chain for supernumerary teeth fall under periodontics in this case? So where you have to go and look at the bone, take the.
Right, so we 9 times, very close, like 9.9 times out of 10, would not pull by chain a supernumerary tooth into the occlusion. We would pull an impacted tooth into the occlusion. That's supposed to be there. Supernumerary is an extra tooth, all right? So we don't necessarily want to bring those unless the supernumerary is replacing another tooth, which might be the case in children who have cleft lip and palate. That's a whole nother shebang bang. But it's very possible that could either be, that could fall under perio, ortho, or oral surgery. Okay? So he's talking about exposing an impacted tooth surgically, placing like a wire mesh, and it has a metal chain on it, and ultimately through the process of, well, using elastics and forces to attach that that chain to the orthodontic wire, to use traction and forces to bring that tooth through the bone and through the gingiva into the arch. All right. All right. What is? I want y'all to think outside the box. All right. Seizure disorder. I know it's. I know y'all been in school for a hot month, right? When school start? August when? Oh, so we're almost at y'all's 1 month anniversary. Okay, very cute. Okay, but I'd hope that this isn't the first time y'all have heard this. So, patients with epilepsy take anti-epileptics, okay? Now, they're going to give you all lots of tidbits just because I've been through this and I know how all of this stuff works. So it's really, we're practicing dental medicine, not just dental surgery. So all of this stuff is connected. You have a patient with epilepsy. Their epilepsy might be controlled with a drug called, starts with either a D or a P. Dilantin or phenytoin, or phenytoin, depends on who's giving the lecture. Phenytoin. One of the side effects of that drug is gingival hyperplasia. All right? So that might be an individual who all other medications doesn't work, but that one does, and that might be the drug that they're on. It's our job to make sure that we're keeping up with those kids because they might, or you might have an adult who's experiencing that maybe throughout their lifetime, nothing works. Keppra doesn't work, nothing works. And they're on Dilantin or phenytoin, and gingival hyperplasia is a thing. Calcium channel blockers also do that. So if you're a general dentist or you're whatever treating adults and your patient is on a calcium channel blocker and it's causing gingival overgrowth, then they may very well be a candidate for a gingivectomy, having to get all of that excess tissue down. But you would certainly want to consult with their medical provider to see if there's some other way to control their hypertension as opposed to the CCB, okay? Any questions? Any other thoughts about perio and pedo? Endo and pedo. Someone mentioned some endo before. What sorts of endodontic stuffs might play a role in pediatric dentistry? Yes?
Is there really a point in doing a root canal on a deciduous tooth?
If that were the case, then I'd really need a teaching gig, okay? Because I had nothing to do clinically. But yes, there is no I'm on recording. Y'all should have told me that. Okay. I've said a couple cuss words already, and I'm about to really get paid for this job.
You're fine.
Okay, great.
You're
Okay.
fine.
Does it
Only,
go?
only we can access.
Okay, great. Okay. Does it like follow me? Oh, okay, great. Okay. Yes, it is. There is a point. There is no better space saver saver than the primary tooth itself. There's no better space holder than the baby tooth. So we want to try to save baby teeth if they are savable, okay? So there are times where you have a severely carious tooth and it is not salvageable. Maybe there just simply is not enough tooth structure. Even if you were to do the baby root canal and put a crown on there, you might not have enough tooth to put a crown on. So the tooth may very well have to be sacrificed. And then you're looking at some sort of space maintainer to keep the space in the absence of a tooth. Alrighty, but there's no better space saver than the baby tooth that you've got, especially when you've got another tooth coming behind it. Alrighty? So baby root canals come in two forms. This isn't this class, but like I said, all this stuff is going to creep up throughout your dental school education. A pulpotomy and a pulpectomy. Alright, those are procedures that we typically perform on primary teeth. Has anyone taken medical terminology before? Was that hand?
Yeah.
So what is otomy? What does the suffix otomy, O-T-O-M-Y, mean? Hiya.
Cutting.
To cut is otomy. Okay, so pulpotomy literally means to cut the pulp. All right, you guys know the butterfly shape, right? I don't have those pictures. This lecture changes. I never know where this conversation goes based off of you guys' responses. So that's the beauty of this and knowing your stuff so you can take the lecture where you need to. So the butterfly, we got the pulp chamber, and then you have your pulp canal. So a pulpotomy pertains to cutting the pulp. You are leaving the pulpal tissues in the canals. You are removing the affected or infected pulp from the chamber. You are cutting the pulp. Okay, then you're putting some medicine inside or not to keep the rest of the tooth alive, because there is still nerve tissue that is called vital pulp therapy. So the tooth is still alive. You've just removed the pulp. Typically you're placing some sort of a filler in the pulp after you have disinfected it, and then you're placing a full coverage restoration, i.e. a stainless steel crown, same day. Ectomy, come on now, ectomy, E-C-T-O-M-Y, anybody? To remove, so tonsillectomy, appendectomy, so you are removing the pulp. You're going in, you're cutting the pulp chamber, and you're using brooches or files to remove the pulp tissue from the canals, okay? So, same sort of thing, still need to fill it with something. In primary teeth, we use a calcium hydroxide medicament. We are not placing gutta percha. You guys know what gutta percha is? The pink stuff that they put in root canals, okay? Comes from the gutta percha tree, some tree. Indo will have you, Dr. Mickle and his team will really get y'all together with that, but it comes from the gutta percha tree. And it's pink stuff. That stuff does not resorb. So that's why we don't put it in primary teeth. Okay, because, all right, so baby tooth, big kid tooth. If I put something inside the tooth that does not resorb, then it can cause damage to the succedaneous permanent tooth. All right, succedaneous is a good word. Write it down. S-U-C-C-adaneous. Start it and Google will finish it. S-U-C-C-E-D-A-N-E-O-U-S. Anyway, so permanent tooth that replaces the primary tooth is a succedaneous tooth. So we put in calcium hydroxide, which does resorb along with the root structure of the primary tooth, so that the succedaneous tooth should not be adversely affected. Okay. Any other instance where you might use endodontic treatment in a child?
You wouldn't do an apricot, would you?
Probably not in a primary tooth. I mean, in a child. Probably not an apricot. Y'all can look that up so y'all know what we're talking about. I can't even say it, so y'all know I really don't know what it is. I'm just kidding. I know what it is, but y'all supposed to learn. Anyway, so apicoectomy. Y'all look at that. It's going to be more for your permanent teeth in your adults, but we'll take it a step before that. So an apicoectomy. Somebody look it up and then tell me what it is. So I can, root resection, right? So it's typically happening after a tooth has already received root canal treatment, okay? So now that's gonna be a permanent tooth that has gotten root canal treatment and maybe the lesion has not like healed or it's just something ain't right about it. So they go in, it's a surgical procedure, they hopefully get out whatever that cyst is, and then off the diagnostic, but they amputate the root that's associated with it, and now you have your gutta percha fits up firmly up against your now apex of the tooth. But how did we get there?
A failure of a root canal.
Failure of a root canal.
So
But
retreating.
right, so it's a retreatment aspect, possibly. Well, yes, it is. But even before that, for a kid, more often than not, you've got two ways. Yes.
Is it
Trauma. Thank you. Trauma would be a reason a permanent tooth is getting root canal treated in the first place. Okay? Or you have a severely carious tooth and now you have a pulpal exposure and a root canal needs to be dealt with. Okay? But trauma was where I was going with that. All right? Good here? Ortho. Alright, don't all volunteer at once.
Palate expanders. Palatal expansion.
Rapid palatal expansion or palatal expanders. Yes. What's back here, sweetheart?
braces?
Braces. Yes. Spacers. You just said that. I'm trying to follow the spacers. Yes. Fall into this orthodontic category. We can go on to spacers for a hot second if we don't get anybody else. Drop some knowledge. Okay. Different types of space maintainers. I'm just going to rattle them off. You guys look them up. Okay. Band and loop. Distal shoe. Lower lingual holding arch. Nance appliance. N-A-N-C-E. TPA, transpalatal arch. All right, and those are, for the most part, your space maintainers. Okay, some can be chair-side space maintainers, some are laboratory fabricated. All right, or if you're that the bomb, the lab could be you. You can get a little welding machine and get your wires up against and solder them to your metal bands. I'm not that. I'm okay sending that to the lab and not providing that service to my patients. Alrighty? So, let's go back to, I'm gonna do it, I gotta call you Alabama because I forgot already. Brian, okay, that's what I thought, okay. Brian had said earlier about replacing a missing permanent tooth with an implant. Is there a way we can replace the tooth? Yes.
Can you do it with like the retainers that go up top and hold the fake tooth?
Yep. You can have a pontic or a fake tooth attached to the retainer itself, so on a removable appliance. That's kind of what it is. Or a flipper that doesn't have any, typically it doesn't have any posterior retention. But then you can have your appliance designed in a way where it either is attached to the wire in a retainer, or it's attached to the palatal aspect. It's attached to the palatal acrylic of the appliance. We sometimes call it a flipper, or we call it a flipper with clasps on the back. Because oftentimes as these permanent teeth are coming in, or they might be 8. I mean, summer times where you see more flips over the handlebars, more avulsions of teeth from bounce houses, that sort of stuff, and whether they find the tooth or if the kid swallowed the tooth, I'm pretty sure we're not waiting for those teeth to pass and then reimplanting. If it's not happening, then we find other ways to give the tooth something, the child something that's more aesthetically acceptable for them. Okay, so giving them something with clasps that they can eat with is desirable, as opposed to just something that, if you look up your traditional flipper, it's typically just maximizing the embrasures of the below the contacts of posterior teeth. So it's all a palatal appliance. Oh, I just saw this funny video on Facebook. Let's see if we can find it on YouTube. Oh man! All right, wait a minute. Let's see.
Oh, is this when the dentures come out?
Oh. I hope this is it. Get it, bro. See number 8 trying to escape? That was a flipper. It's all palatal. That's going. That's gonna land on somebody's windshield.
Yeah, you ain't finding that.
So it's good to have my little thoughts going through. That was funny to me. If she would have had an appliance that had
Let's go watch it.
I love you. I'm sorry.
okay, only all of that. All right. So if she would have had an appliance with y'all can look it up. Adams clasps, Adams like Adam, apostrophe S, clasp or ball clasps. Those are going to engage posterior teeth differently in order to create some more anchorage for the appliance. That one was solely in her mouth, just from the acrylic on the palate. And you saw the scalloping of the edge of it. It's meant to fit inside the embrasures on the palate and just kind of get the retention that way, which obviously was not effective when she was skydiving. I don't know if she would have used some fixative, would her outcome have been different. But needless to say, it served a perfect timing for what we just talked about. Okay, oral surgery.
Cleft palate.
Cleft palate, what about it?
When people are born with cleft palates, they need to fix.
People born with cleft palates and getting them fixed. What's the organization that does that? Smile, Operation Smile. Yes. So if that's your sort of thing, look into that. Yes.
Other type of jaw abnormalities.
Ooh, like what?
I don't know what it'd be called, but some people have issues with their jaw.
Like TMJ sort of stuff?
Yeah, but I feel like some kids are born with smaller jaws or they're not in the right position, so they'll see an oral surgeon and get put in place.
So we're thinking like bulldog bite sort of thing, where they're like, severe prognathic mandible, PROGNATHIC mandible, so it's way more forward than the upper.
Did you do orthodontic surgery on a child though? Because the jaw doesn't really fully develop until 17, 18. Just out of curiosity. No, I would think you would.
Well, there's still a pediatric, all right.
Yeah, but I would think that the jaw, you wouldn't want to touch it until those
grew
growth
into it.
plates are fused and it's fully formed, which is going to be after puberty. And so at that point, you're talking kind of on the borderline between. Well, so I'm just asking. I know that they did orthodontic surgery.
So there are some kids that would qualify for BSSO surgery. Stands for bisagittal split osteotomy. And it's going to be in those kids who have that severe. So it doesn't matter. I mean, this is a skeletal thing. It doesn't matter that I'm 8 and when I'm 18, if this doesn't get fixed, I'm just going to be a bigger version of this. 10 years from now. You see what I'm saying? So there are some skeletal aspects, and the way that the mandible and maxilla grow is just a little bit different than when we're talking long bones and height. So it's not necessarily, so maybe you do capitalize after their growth spurt, so you might be keeping track of boys until they're 15, 16, and girls until they're after 13, 14, before you consider that, but it's still something to consider. It's a way that oral surgery is involved in pediatric dentistry.
What about problems with the jaw related to juvenile arthritis? And repeated chewing patterns?
I can see that, yeah, absolutely. Whether we're talking appliance therapy, we're making night guards, those sorts of things, so that's not going to be the appliance making, would likely be in addition to, or an adjunct with an oral surgery consultation, so we can figure out where are we trying to achieve this more, so I'm gonna say stress-free, is this because I can't think of what I'm really trying to say. This occlusion, this situation, so this child's not in pain from their arthritis, to get them to something more comfortable. And it might be that they're in some sort of a bite plate, some sort of appliance to help them with that. Yes.
I'm not quite sure where oral surgery stops or plastic surgery starts, but certainly automobile accidents can be pretty traumatic to the face.
Absolutely. You
And
can have.
start almost from scratch in some cases.
Uh-huh. Yeah, I agree, both, and they also, I mean, when I was in residency, and we would be on call, ENT, oral surgery, and plastics would rotate call, because maybe they saw it as like the same service, sort of thing, all right?
Thirds extractions.
Extractions, yep, surgical, you said thirds?
Thirds.
Thirds, yeah, wisdom teeth, third molar extractions, yes.